My name's Siri and I'm a speech pathologist at Optimum Health Solutions, and I'm going to have a bit of a chat about preschool communication and where a speech pathologist might be able to come in handy for a preschooler. So preschool's a really important time for kids. They're learning all those necessary communication, social and academic skills that they need to be able to thrive in the classroom. And in this environment, if a child is having difficulty with any areas of communication, that can impact their ability to make that transition to school. And if there is a child who is having trouble in any of these areas, it could be a good idea to consult a speech pathologist if you have any suspicions that there are areas that a child might be having difficulty in. Speech is an area where a speech pathologist could assist a preschool-aged child who might be having trouble in the preschool environment. Speech covers the sounds that we make when we talk. So if you think about a lisp or someone who mixes up the sounds in words, that could be an example of a speech error. And a child who speaks in nice sentences, but you can't quite understand what it is that their words are saying, might have a speech delay or disorder. Having clear and accurate speech impacts our ability to be understood, which impacts our ability to interact with people, to make friends, and to learn in the classroom. So it's really important for kids who are having difficulty with their speech to have that checked out by a speech pathologist and see if any assessment or therapy is required to address those speech concerns. Language includes our ability to understand what's being said to us and express the things that we're meaning to say. Children who have a speech delay or disorder might speak a little later than the other children, or they might not speak at all. They might not communicate in the same way, or they might not follow directions in the same way to the other kids because they aren't able to understand what's being said to them. Children who have a language delay or disorder could struggle in that transition to the kindergarten environment because there's a whole lot more kids there, there are more complex instructions being given to them, and there's more structure in their day. So this could be an area where a child might struggle if they had a language delay or disorder that hadn't been picked up and hadn't been addressed. A speech pathologist can provide assessment and some intervention for children who are having difficulties in this area and make that whole process easier for them, easier for their families and for their teachers. Stuttering is another area that could prove difficult for children of this age. Stuttering generally appears in that preschool age group between the ages of about 2 and 4. We do know that some children who have a stutter stop stuttering a few years down the track and some don't. But it's hard to know which kids will stop on their own and which kids need more therapy and intervention from a speech pathologist. Unlike with speech and with language, stuttering isn't a normal part of language development. Kids who are stuttering should be assessed by a speech pathologist so you can make that informed judgment on what's best for your family. Preschool teachers are amazing resources when it comes to understanding where children are having difficulties. They're able to see kids of the same age in comparison to each other, and they spend so much time with so many different children. If your preschool educator has expressed concerns about any aspects of your preschooler's communication skills, it'd be a great idea to follow it up because the teacher is really well placed to understand where they're having troubles and where their strengths are as well. So working in a collaborative effort with a speech pathologist and your preschool teacher can really give your child the best opportunities if they are having trouble with any aspects of their preschool communication.